Dr. Davidhizar, you said that prostate cancer is amongst the cancers with men a big, it's rather rampant. Now, is prostate cancer life-threatening or not? Or does it have, even though it might not be life-threatening, does it have other very dangerous aspects to it?
Well, there's different varieties of prostate cancer. Some people, it doesn't seem to be very virulent at all, so it's not very aggressive. And those people, sometimes if they're older, we don't even treat it because it's going to grow so slow that they'll die from something else before that is an issue. And some of the treatments for prostate cancer, can be somewhat debilitating. And in older people, the less you cause problems with that, the better. So, but I've seen some cases where people had a very virulent, very aggressive form of prostate cancer where everything we did didn't seem to slow it down. But in most cases, it's not really that aggressive. So that most people do fairly well with prostate cancer, especially if we catch it early. We have a new test now, the PSA test, which actually is not that new anymore. It's been around quite a while. But I do that on all my men over 50, and if they have a cancer history, we do it even starting at 40, because it's the most common cancer now in men. And like I said, the good thing is that most of the time it doesn't grow that fast, and we have lots of options for treating it. There's all kinds of new treatments out there for it now that are very effective. And so sometimes it isn't very life-threatening, but it can be. So you just have to, determine which type you have and what needs to be done.
I see. And the treatments, whatever treatments do exist, are they painful?
Yeah. Well, some of them are surgery, where they just remove the whole gland. The problem with that leaves most people impotent. Most men don't like that idea. So some men have opted not to have that done, where that might have been the best choice. But we have lots of other good choices now. We know that most of the prostate cancer is fed by testosterone. So there's shots now that will decrease your testosterone production pretty much to zero, and most of the time that just stops the tumor right in its tracks, and it doesn't grow much anymore. Sometimes that's all that's required. Now, if you get it too late and spread it in the bones and stuff, even then, sometimes these anti-testosterone shots work really well, and they'll stop the pain and stop the progression of the disease. If you can do that, it doesn't matter. If you've got some tumor there, as long as it's not growing and causing any trouble, you can function fine without it. There's also new radiation treatments for it. They implant seeds of radiation into the prostate, or there's just also direct radiation to the prostate. So there's multiple options now for treating it, and so I sort of recommend the patients see one of the oncologists and get all their opinions, and then they make up their mind which the method they prefer. But there's multiple choices now for treatment.
Okay. So, should men unnecessarily worried about getting it and life is over, so to speak, when that's really not quite true? Yes, there's some inconvenience, yes, there's some treatments to take, but basically one can take care of it, one can still be staying, not getting impotent and stuff. So should we not worry quite as much as maybe we do?
True. I think most times people do well with that cancer. People still die from it, unfortunately, but most of the time that's not the case. Especially if it's caught early, there's lots of good treatments for it. We keep it under control, and shouldn't be a big issue.
Wonderful. Good to hear. Thank you very much for your good information again. Bye-bye, Doctor.
You're welcome.